I am Dr. Harvinder Singh. Welcome to Psychiatry Education Forum Academy's next discussion. And in this section, we will talk about generalized anxiety disorder treatment algorithm. And this is a very big topic. So to make it easy and not very long videos, I have divided this into various sections here. So overall, what I will talk about is which medications to start on, which medication you can switch to, augment to, and how long to continue treatment for. So I will only talk about clinically relevant topics here. And this is the table that I will attempt to answer by the time we will finish full sections. So you see there are many empty boxes and question marks here. So I will start with which medication should be your initial choice, how long to continue the treatment for, depending on good response, partial response, or no response, how to proceed, and how long to continue treatment for once you have good response. So let's start with the first one. In this video, I will only talk about the initial medication of choice for generalized anxiety disorder. So we know how common generalized anxiety disorder is, and we should know common treatment and which medications are approved, not approved, and their efficacy. And before I proceed forward, I just want to say I will not point my personal clinical experience here, but I will try to only quote the results of the studies published for each medication so that you can make an informed decision. So, before we move forward, let's make it more interesting. Let's answer this very common clinical scenario that we see. So this is a 35-year-old female referred by her psychotherapist. So she is in therapy already for anxiety. So she's referred for recent worsening of anxiety with difficulty controlling her worries. And her anxiety is associated with muscle tension, difficulty relaxing, associated irritability, and worrying about something negative happening. So you did the screening tool after your interview. GAD 7 score is 17, which puts her anxiety in a severe range. No known medical history. Let's say you did the blood work and there is no thyroid abnormality or any abnormal medical causes for her anxiety right now. She's not using any drugs and her urine drug screen is negative. So which of the following serotonergic medication will be your first choice for this case? So I know it's a very difficult clinical scenario. Ideally speaking, we don't choose medication just based on scenario, but there are many other factors that goes into picture, which includes patient's full presentation, their medical history, what other medications they are taking, their past response to certain medication, and family response to medications, and many more. But I'm not going there. If we have to choose one medication based on the studies published, which one medications will you choose here if you have only one option? Is it fluoxetine, paroxetine, sertraline, escitalopram, or venlafaxine? And this is what this discussion is all about. So we will answer this question in the end, or you will get the answer by the time I finish this presentation. So let's begin this presentation now. So what are the initial medication of choices here for generalized anxiety disorder? We all know that serotonergic medications are first line here. I mean, definitely therapy is first line. So in this section, I'm only talking about medication. So my talk is only focused on psychopharmacology right now. So serotonergic medications, SSRI and SNRI are the recommended first-line treatment. And let's understand which one is better here if we have to choose our first medication of choice among these 7 options mentioned here. So we know there are many randomized controlled trials for these medications, and I don't want to go over each randomized controlled trial, otherwise this will get more confusing and very long video. So to make it more easy for everyone, I will be comparing these medication with these 4 guidelines. So first I will go over which medications are FDA approved for generalized anxiety disorder. That's very important. And then I will go over Canadian clinical practice guidelines published in 2016. And then I will go over most recent update published into Psychopharmacology Algorithm Project by Harvard South Shore by Dr. Ozer in 2020. And then we will go over RANS-CP, which is the Royal Australian and New Zealand College of Psychiatrists guidelines published for generalized anxiety disorder in 2018. So hopefully by the time I go over these 4 things, we will have more clear picture of which medications are or should be preferred over others. And again, I want to say I have no financial disclosure or I'm not getting any money from any pharmaceutical company. No disclosures from my side. Now, let's start with the FDA approved medications first. So which of these do you think are FDA approved for generalized anxiety disorder? Well, only 4 are. So escitalopram, paroxetine, venlafaxine XR, and duloxetine. They are FDA approved. Interestingly, sertraline, citalopram, and fluoxetine, they are not FDA approved. Very interesting. And I'll say why I'm saying it's interesting in the end. Now, so this was FDA approval. I just want to very quickly mention the medication approved in Canada for generalized anxiety disorder. So in Canada, escitalopram is approved for GAD, paroxetine is approved for GAD, venlafaxine XR, and duloxetine. So similar thing in Health Canada also. But now let's look at the Canadian Clinical Practice Guideline published in 2016. So what these guidelines do is they actually summarize everything as first line, second line, third line are not recommended. And as you all know, these first, second, third lines are based on the level of evidence. First line have better level 1 or level 2 evidence plus clinical support for efficacy. Second line is level 3 evidence with clinical support for efficacy and safety. Third line have a lower level 4 evidence, and I will not go into level 1, 2, 3, and 4 evidence. But very briefly, level 1 is, at least 2 randomized controlled trial or meta-analysis. Level 2 is at least 1 randomized controlled trial with placebo. Level 3 is uncontrolled trial with at least 10 subject, and 4 is lower than that. So obviously level 1 is better than level 2, than level 3. So let's start with level 1 evidence. The highest level of evidence is available for these 5 medications, and which are, all the 4 FDA approved one: escitalopram, paroxetine, venlafaxine XR, and duloxetine, in addition to sertraline. You see the sertraline has level 1 evidence right now based on the Canadian Clinical Practice Guidelines. One thing I want to mention here is I have not mentioned paroxetine CR, the longer acting form here. But when these guidelines were published, the paroxetine CR didn't have many evidence. So they actually kept that in a little lower range at that time, which was actually level 3. I have not mentioned that here. So as you see, level 1 recommendations are very similar to FDA approval except for sertraline also in level 1 due to the presence of multiple good randomized controlled trials supporting the efficacy. And also they mentioned that when they did head-to-head comparison between SSRI and SNRI, the efficacy was similar. And although there was one study which showed the escitalopram to be less effective than venlafaxine XR, but other than that, most of the data is very similar for SSRI and SNRI at this time. I will not go into other medications at this time in this video like tricyclics and other medication that we use for generalized anxiety disorder. I will be talking about them in our next video soon. So this is level 1 evidence. How about these other two medications, citalopram and fluoxetine? They actually received level 3 recommendations by these Canadian guidelines because at that time there was limited data. Most studies were open label studies or case series for citalopram, fluoxetine, paroxetine CR as I mentioned, and mirtazapine, which I have not included here. So these were actually level 3 recommendation based on the Canadian guidelines. Now let's move to our most recent guidelines, which is the Psychopharmacology Algorithm Project by Harvard South Shore. And this was just recently published, or I should say this was published in 2016 or so, but they do keep on updating this every year. So these are the most recent updates. And what did they say? So just like what we just talked about, SSRIs are actually preferred over SNRIs according to this. So they recommend to start with SSRI first before jumping to SNRI. And among SSRI, they recommend sertraline, escitalopram, and paroxetine. But we know the paroxetine have the highest side effect risk. So based on the Psychopharmacology Algorithm Project, the sertraline and escitalopram are the first preferred one, followed by paroxetine. And the interesting thing from this study that I found was about citalopram. So they recommended to avoid citalopram and they didn't find any dose-response relationship. And the main reason we know why they are asking us to stay away from citalopram is the QTC prolongation risk and those side effects with that. So this is the Psychopharmacology Algorithm Project here. Sertraline and escitalopram on top among SSRI, followed by paroxetine, and avoiding citalopram. I should not even say 3 there, they say avoid it. But yeah, let me know what is your clinical experience with that. We all use citalopram, escitalopram. I mean, personally speaking, I know I said I will not quote my personal clinical experience here, but I use more of a escitalopram if I have to choose this medication over citalopram. It's available as generic and it's not costly. So I mean, I don't see any reason to go to citalopram, but again, please let me know what do you all feel or think based on your clinical experience. So this is the SSRI. They didn't mention anything about fluoxetine. Now going to the SNRI class based on the Psychopharmacology Algorithm Project. This is again interesting. So among these two SNRI, they recommend duloxetine over venlafaxine, and their reasoning is the venlafaxine have the side effect profile more than duloxetine in terms of the blood pressure effect and sweating effect, so they prefer duloxetine. So let me put this in the table here. So you see the duloxetine comes on number 4. Actually, I think I should make it number 3 because they recommend citalopram to be avoided. So sertraline and escitalopram first, followed by paroxetine if needed, followed by duloxetine. This is what the Psychopharmacology Algorithm Project recommends. Now let's end this by talking about the last guidelines, which is the Royal Australian and New Zealand College of Psychiatrists RENS CP, published in 2018. I will not go into detail, but I will just summarize what they talked about. So they say that both SSRI and SNRIs are effective for GAD treatment, and among SSRI, they say sertraline, escitalopram, and paroxetine, and among the SNRI, venlafaxine and duloxetine. But when they looked at studies, this is how they summarize it. They say two antidepressants which showed greatest benefit on GAD symptoms are duloxetine and sertraline. Very interesting. So far, we have seen sertraline to be doing well despite not being FDA approved. And duloxetine also received good recommendation from the psychopharmacology algorithm project there. So that's number one. So the response, the benefit is there. How about remission of GAD symptom? Which two antidepressants showed highest remission rate? Well, escitalopram and venlafaxine. So we can't ignore these facts. I mean, it's difficult to choose one medication here, but almost every antidepressant is showing some benefit over other. Or not, or let me take this back. I should say these four antidepressant, sertraline, escitalopram, venlafaxine, and duloxetine, they are showing definitely better on this guideline also. So let's go back to our table. So based on RENS CP, escitalopram, venlafaxine, and duloxetine are good options. How about sertraline? Well, they mentioned that sertraline has the best tolerability. We saw the greatest benefit on symptoms, but best tolerability was for sertraline. And in the end, they say that sertraline has the highest acceptance, risk to benefit ratio, and cost effectiveness profile of the pharmacological treatment options for GAD. So this medication, sertraline, comes as a star there. So this is a summary of these guidelines. I believe based on this, sertraline is definitely worth considering as first medication of choice based on these guidelines, despite not getting FDA approval. But if not, I will definitely consider escitalopram, venlafaxine XR, or duloxetine. But again, we need to be mindful of the side effect profile of these medications. These are not, totally non-side effect causing medications. We have GI side effects, sexual side effects, and many more. I mean, if you're interested, you can go up and read about antidepressant psychiatric side effect management section in our membership. But one thing I want to say, which I totally forgot, is you see venlafaxine is XR, not IR. And this is an interesting point. For anxiety disorders, generalized anxiety disorder, XR is preferred over IR treatment here. And again, paroxetine, if possible, avoid it. But I do use paroxetine as a last resort when other medications are not giving the benefit that we need. But the other thing I always keep in mind is, young females of reproductive age, paroxetine is one medication we need to be very cautious of. It should be avoided in pregnancy or someone who is planning to get pregnant. And then citalopram is one medication that psychopharmacology algorithm project recommended to avoid. But so friends, this was a very brief overview of comparing these serotonergic medications for generalized anxiety disorder management. And this last slide is actually just me summarizing all the dosing of medication. And I think this is the most clinically relevant slide here because you see what I wrote on top, start low and go slow. This is very, very clinically relevant for anxiety disorder treatment. Never start the medication on the starting dose that we use for depression treatment. Always start low and go slow, maybe after a week or so or 10 days or so to increase the dose. And that will prevent any negative activation of physical symptoms with these medication. We know how a person who have generalized anxiety disorder, they are more sensitive or receptive to physical sensation coming from these medication initiation compared to other person who don't have anxiety or only depression, I should say. So always start low, go slow, and treat the comorbid conditions also for anxiety disorder treatment. I will put the slide below, so I will not go over each medication dose here. So friend, this was a very brief overview of the first section, which is initial medication of choice. In my next video, I will go over what is the adequate trial for each medication and how to augment or switch if we are seeing partial response or no response respectively, and also how long is a good duration of trial once patient have shown response or remission. So this section is available for free preview, but all the upcoming sessions will be available for Psychiatry Education Forum Academy membership only. Again, if you have any questions or any inputs or comments, please don't hesitate, either reply below or send me your questions to hsingh@psychiatryeducationforum.com. Thank you again, friend. This is Dr. Singh signing off. Bye for now.